How you feeling?
Not so good.
Not so good? Oh, let me feel your head.
Whether it's to relieve symptoms related to a cold, allergies, aches and pains, or fever, millions of American parents turn to over-the-counter medicines to ease their children's ailments.
Children will get approximately 10 viral-type illnesses a year associated with cold and cough, and therefore parents are going to want to help their children.
Over-the-counter, or OTC medicines, are safe when used as labeled, but can have risks when misused. It is important that parents and caregivers in charge of children's health and well-being always treat medicine with care and know how to safely give OTC medicines to children. This is a big responsibility, but it doesn't have to be a difficult one.
Has he had any fever?
Maybe one a day ago, like 99.8.
When parents are giving medications to children, there's a couple of very important points that they should keep in mind. Parents should read the labels of the medications they're giving, should choose a medication that is appropriate for the symptoms of the child, should certainly not give the medication any longer than is recommended, and lastly, should not give the medication more often than is recommended. Christopher looks fine. His lungs are perfectly clear, his ears are fine, his throat is okay. He has a little bit of runny nose and a postnasal drip. He has a little bit of cold.
Okay.
When giving medicine to children, here are some other important tips doctors say to keep in mind. Never guess the amount of medicine to give. Measure exactly. Don't decide to give more medicine because a child seems more sick than the last time. Use the measuring device that comes with the medicine. Never use longer than the label instructs or at higher doses unless your doctor specifically tells you to do so. Don't give children adult-strength formulas. Only use the medicine that treats your child's specific symptoms. Don't give your child 2 different medicines with the same active ingredient. Never give aspirin-containing products to children or young people for cold or flu symptoms or the chickenpox because of a possible association with a rare condition known as Reye's syndrome. Do not give oral OTC cough and cold medicine to children under age 4. Talk to a doctor with any questions.
Every 6 hours, okay?
Make sure your child's doctor knows all the prescription medicines, over-the-counter medicines, and dietary supplements your child is taking to avoid any interactions or overdosing, or consult your pharmacist.
You're going to give this to her about 3 or 4 times a day. The dose that you're going to be giving her, basically right up to that point.
Okay.
If you have any questions regarding the use of over-the-counter medicines, speak to your doctor, healthcare provider, or pharmacist.
All right, Chris, one more high five. We'll see you, buddy.
By keeping these tips in mind, you can keep your kids safe, healthy, and help them feel better during the cough and cold season ahead. For more information, visit otcsafety.org.